My hip started giving me some problems, just minor aches and pains about 6 years ago.
He never really talked about it until you could see that he was limping.
Over-the-counter pain medication was about all I did for the hip. It became noticeably worse and had to, at that point, start to use a cane for support. The next step, as far as my hip was concerned, was probably a wheelchair.
It was pretty evident then that this was not going to get any better, and it was something that we really needed to address.
My wife and I had already decided to go to France, and that would have entailed a lot of walking, climbing, etc. And so we decided to see someone about a hip replacement. We did a little bit of research on the internet, and we decided to see Dr. Clementi at Memorial Hermann in the Woodlands.
When Stan first came to see me, he was frustrated with the fact that he was walking with pain every day. He had a pretty significant limp. He had loss of flexibility in the joint and was tired of all of that. Hip replacements, like any joint replacement surgery, is done when your quality of life has taken a big hit, especially after non-surgical options have failed to provide adequate benefit. The Joint Center has multiple parts to it, multiple people that work as part of this Joint Center. When a patient first comes to the Joint Center, even before surgery, they get to tour the facilities and kind of learn ahead of time what all is involved. They're encouraged to ask any question about surgery. My approach has always been to spend as much time with every patient as seems necessary, and they're the ones that dictate that.
He was very straightforward, and he talked about the two different procedures.
He explained that there'd be minimal damage to muscle and nerves.
Within a couple of weeks, we could actually have the surgery done.
It's not at all a painful process.
It's a fairly easy surgery, very easy on the patient, and recovery time is very, very quick.
The Joint Center puts on a class that we'd like to have them come about 3 weeks or so in advance of their actual procedure. It's encouraged that some family member is there as well, because they learn just as much as the patient does.
Really was the best thing we could have done, and it was about 3 hours long. And a number of different people spoke to us about what to expect when we went into the hospital, what to expect after surgery. We went in with a really, really good feeling. I can't say we ever did that with any other procedure that Stan has had to endure.
They could put Humpty Dumpty back together again. By the end of that day, they had me up taking a few steps. I was in the hospital for 3 days. Each day we had physical therapy sessions.
I stayed the 3 nights that he was in the hospital. Everybody that we came in contact with was just very supportive, very encouraging. When we got home, as soon as we walked in the door, he was able to go up the stairs, which really, really floored us.
It's kind of a miraculous transformation. My wife and I did go to France, and that was 5 months after the surgery. And it's rejuvenating both physically, obviously, and psychologically, because you begin to think, longer term. I play golf with the grandkids and that sort of thing, and it gets stronger every day. It's still getting stronger.